Hello everyone. Today we're going to focus on the upper digestive tract, and that is chapter 38 of your book. These are our learning objectives. So we're going to discuss the generalized function of the digestive system, list in sequence each of the components or segments of the alimentary canal from mouth to anus, and identify the accessory organs of digestion located within the GI tract or that open into it. List and describe the 4 layers of the wall of the GI tract. Discuss the major modifications of the layers of the digestive tract. List and describe the structures of the mouth, and identify and compare the structures and secretion of the salivary glands. So let's begin with the function of the digestive system. So the parts of our digestive system, they work together to perform some general things, and those things are: first, we ingest our food. Of course, we chew our food, and a more, I'll say, medical term is called mastication. And then we digest the food. All right. And then there's some other components such as secretion, absorption, and also excretion. So all of the organs are going to work together in order to give us the nutrients that we need in order to live. So most of the food that we eat is in a form that our cells can't use. So basically, before we can use it, the body has to do its job, or the digestive system has to do its job. So some of that is modifying the physical state of the food that we eat, and also the chemical state of the food that we eat, so that we can absorb the nutrients that we need for our body cells. All right, now we're going to move into the organs of digestion, and this is figure 38-1 of your book, and it basically shows the location of all of those digestive organs. And there's also a list in box 38-1, a list of the organs that are within our digestive system, as well as those accessory organs. So the digestive system, sometimes it's called the alimentary tract or alimentary canal. Some books also call it the GI tract. It's probably about 30 feet in length, and it's a muscular tube. You can call it a tunnel-like structure that contains all of these organs of the digestive system. The tube begins at the mouth, and of course it ends at the anus, which is one of our objectives, so that we would talk from mouth to anus. And between those 2 points, we have some other organs, and those organs are the pharynx, which we learned about last week, the esophagus, we learned about that as well, the stomach, and also the small and large intestines. In addition to that, we're going to go over some of the accessory organs like our teeth, the tongue, and also the salivary glands. The liver is also involved, as well as the pancreas and the gallbladder. And all of these are needed for the processing of the food that we eat, because again, we need to process the food into something that's usable so that our body can absorb it. So again, the main components of the digestive system, they're going to work together to perform the ingestion piece of the food. Mastication, of course, we're going to chew the food and then we're going to digest it. Then we have secretions and absorptions to put it in a workable form so that we can absorb those nutrients. And then, of course, last but not least, we're going to secrete or excrete anything that is not in a form that we can use. All right, now we're going to look at the walls of the alimentary canal. So basically, we're talking about the lining of the walls that start at the esophagus, and it goes all the way down. So of course, right here we have the mucosa, the submucosa, the muscularis, and also the serosa. So the mucosa is made up of 3 layers. We have an inner layer or inner mucous epithelium, which is a layer of loose fibrous connective tissue. And that layer is called the lamina propria. Then we have a thin layer of smooth muscle called the muscularis musculae. All right, so again, the innermost layer that lines the lumen of the canal is called the mucosa, and it's similar or like the same lining of our respiratory system. All right, and that layer again is composed of mostly stratified squamous epithelium with some connective tissue and also a thin, smooth muscle layer surrounding it as well. The mucosa also has it's able to secrete digestive enzymes to help break the food down. And then it also contains goblet cells. And those goblet cells, as we learned last week, secrete mucus for lubrication. In terms of the submucosa, it contains glands, blood vessels, and also parasympathetic nerves. So the submucosa is the next layer. And again, it is also composed of connective tissue, and it contains the blood and lymph vessels and also lymph nodes. It also contains what we call Peer patches, and those are patches that are similar to the tonsils. And of course, we have nerve endings as well in this layer. All right, the next layer is the muscularis, and that's a thick layer of muscle tissue that wraps around the submucosa. So again, the muscularis externa is composed of 2 layers of smooth muscle. All right, and the innermost layer surrounds or encircles the canal, and the outermost layer is basically follows or lines the direction of the canal. All right, there is an additional 3rd layer of smooth muscle tissue, but it's only found in the stomach. All right, last but not least, we have the outermost layer, which is the serosa. All right, and it's made basically of a layer of flat serous fluid producing cells that's also supported by connective tissue as well. All right, so in terms of the digestive tract, we already talked about the different layers, but there are modifications in the layers based on the function of the layer, what it needs to do, and also the location. All right, the reason for these modifications is for the body to be able to digest, absorb, and of course protect the lining. So in terms of those variations, the epithelial layer again is going to change or adapt to the specific function of that section of the digestive tract. So the 2 main types of epithelial cells that are found in the digestive tract are stratified layers of squamous cells and also simple columnar epithelium. So the stratified layers of the squamous cells, they're found in areas that are exposed to what we call mechanical stress. So that's mostly in the upper part of our esophagus. And the role of this layer is basically to protect from abrasion from the food, because of course the food is traveling down, and also other materials that we ingest. That stratified structure is going to allow for what we call shedding or a constant renewal of those cells, because it needs to maintain that protective barrier. Then we have the simple columnar epithelium that's found throughout most of the digestive tract. That includes the stomach and also the small and large intestines. And that layer is designed more so to help with absorption and also secretion. So it does contain a layer of cells that produces what we call digestive enzymes and also mucus, and that's going to aid in digestion and also the movement of that food. In terms of our exocrine glands and also secretions, the exocrine glands are located in the epithelial layer. And basically it's going to empty the secretions into the lumen of the digestive tract. And secretions that we're talking about mucus for lubrication, the digestive enzymes to help break down the food, and also bicarbonate to help neutralize the stomach acids. So there is a table in your book, table 38-1, that we mentioned earlier. It shows you the modifications of these layers and the reason for the layers, meaning why are they significant for digestion. So take a look at that chart or table so that you can better understand why these modifications of the epithelial layers are important to aid in digestion, absorption, and also protection. All right, this is a visual of the wall of the GI tract, and of course you can see the 4 layers that it's made up of. All right, so in terms of the layers, we have the mucosa. All right, that is the innermost layer. The first layer that our food comes in direct contact with. Again, it has special cells that secrete mucus that make it easier for the food to move. All right, it also, of course, absorbs the nutrients from that food into the body. All right, the next layer is the submucosa. All right, so that is the second layer. And again, we said that it contains blood vessels and also nerves. In terms of the blood vessels, they help transport the nutrients to the different parts of our body. And the nerves, of course, help control the muscle contractions that we need in order to keep the food moving along. All right, the next layer we have is the muscularis. And the muscularis is the third layer. We said that it's made up of muscle, and those muscles need to contract and relax in order to help push the food forward. All right, and we call that movement peristalsis. So basically it's contracting and relaxing to forcibly push the food down, like kind of like squeezing a tube of toothpaste. That's how our food moves down the digestive tract. And last but not least, the outermost layer is the serosa. So that's the protective outer layer of the GI tract. So this layer helps reduce friction between the digestive organs and other parts of our body. And it is basically connected to what we call a special fold, and that's called the mesentery, and that helps hold the intestines in place. So basically, in a nutshell, these are the digestive, in terms of the digestive glands. The key takeaways here are we have those 4 main layers that help with digestion. The mucosa absorbs nutrients, the submucosa contains those blood vessels, and the muscularis helps move the food, and of course the serosa provides protection. The mesentery, which is not a layer, but it is what helps keep everything in place. And last but not least, with all of this, we have digestive glands. And those digestive glands, they're going to produce enzymes and acids that are going to break the food down. The digestive juices that are released into the GI tract, they're released through small ducts. And some of the examples that I can give of the digestive or accessory organ type glands are going to be the salivary glands, which we will go over. They produce saliva to break down starch in the mouth. We're going to talk about glands that we have in our stomach that release acid to digest proteins, and then also the pancreas and the liver also assist as well, because they help with those digestive enzymes. All right, so now we're going to take a look at the structure of the oral cavity or the buccal cavity. And the the reason why the oral cavity or the buccal cavity is important because that's the first part of the digestive system. In addition to playing a part in digestion, it does help with speech and also sensory perception such as taste and touch. So this slide basically is going to focus on the lips, the cheeks, and also mucous membranes, along with some other key structures like the philtrum, the tuberculae, and also the buccinator muscle. So let's start off with the lips, also known as the labia. And the lips are covered with skin, of course, and internally by mucous membrane. They help with speech, they help with facial expressions, and they also seal the mouth while we're eating. So if your mom ever told you to close your mouth while you're chewing. So the junction between the skin and the mucous membrane, it's very sensitive and it allows us to feel the temperature and also the texture of our food. So some of the key structures of the lips, the upper lip, the philtrum, that is a shallow vertical groove in the middle or the midline of the upper lip. And then we also have the tuberculae, and that's a small prominence at the junction of the skin and also the mucous membrane that helps add the shape to our lips. All right, in terms of the cheeks, which are next, the cheeks form the lateral borders or the sides of our oral cavity. So they are covered inside by mucous membrane and also externally, of course, by our skin. Within that area, we have what we call the buccinator muscle, which forms most of the cheek structure. And it also helps with chewing by keeping the food in place. Now, the mucous membrane and also the gums lie in this area. The mucous membrane, of course, lines our entire oral cavity, and it continues onto what we call the soft palate and also the gums. They're also a part of this area. Their job is basically to secrete mucus to help keep the mouth moist and also protect it from irritation and help us with our swallowing actions. That is pretty much it. Now, when it talks about adipose tissue, fat and also mucus secreting glands, that buccinator muscle is surrounded by adipose tissue. So we're talking about fat tissue. That fat tissue does help gives our cheeks the shape that they have. They're also in that area we have mucus secreting glands located between the buccinator muscle and also that mucous membrane. Again, it helps keep the mouth moist and also lubricated. So the reason why these structures are important is because the lips and the cheeks, they help control the food and also liquid while we're eating. The mucous membrane protects the oral cavity from irritation and also dryness, and that buccinator muscle plays a role in allowing us to chew and also allows us to speak as well. So the oral cavity is one of the essential parts of digestion because that's where that process of the food being broken down starts. The lips, cheeks, and mucous membranes, they all work together for eating, for speaking, and also for different facial expressions that we have. So this is a diagram of the oral cavity, and this figure is also in your book as figure 38-4. So we're talking about the oral cavity, also known as the mouth. Again, we said that that's the first part of the digestive system, and it also helps us with speech, chewing, and also swallowing. So it is a key component for digestion. So if we're looking at this picture, we can see the lips, of course, the upper lip and also the lower lip. That's the entrance to the oral cavity. It also, this area is going to help us. We talked about sensing, especially, taste and also temperature. All right, the hard palate, which is basically the roof of your mouth. That is a section of the oral cavity, so it forms more like a rigid surface for the tongue to help press food upward against the palate while chewing. And then we also have a soft palate as well. That's basically the back section, but it's still in the roof of our mouth, and it helps with swallowing by preventing the food from entering our nasal cavity. That's the purpose of that one. All right, then we have the uvula. All right, that's that small fleshy-like extension at the back of our throat. It does help guide the food down the throat, and it prevents it from entering the nasal passage as well. We also have the tongue here. That is an organ, muscular organ, that helps with chewing, swallowing, and also speech. It does contain our taste buds as well, so that we can sense or taste our food, different flavors. And then also here you can see that we have our teeth used for breaking down the food into smaller pieces. Of course, we'll go over the different types of teeth. You know, we have incisors, canines, premolars, and molars, and it serves for different functions when we talk about chewing. All right, then we have our gums here as well. They're not necessarily, I don't see where they are listed in the picture, but the gingiva, they do surround the teeth. The gums surround the teeth to help basically support them or keep them in place. All right, and then some other things that it talked about on the previous slide, we have the philtrum. All right, and that's that little dip that helps give your mouth the shape that it has. All right, and that is pretty much it. So this is just a visual of your oral cavity, and now we'll break into the different portions of it, more so in terms of going more in depth of what the responsibility of each part is. Now we're going to talk a little bit about your hard and also your soft palate. So the palate itself is the roof of our mouth, and it's divided into these two parts. The hard palate, which is the front portion, and the soft palate, that's the back portion. All right, and again, these they help us in terms of the digestive system. So the hard palate is made of bone, and it provides us with more of a firm surface for the tongue to press food against while we're chewing. So it consists of 4 bones, 2 maxillae, that's our upper jaw, which we learned earlier, and 2 palatine bones that basically forms the back, which is the hard palate. All right, the hard palate itself helps separate the oral cavity and also the nasal cavity. So it prevents the food from entering the nasal passage whenever we eat. The soft palate is made up of muscle mostly, and it's located right behind the hard palate. And it's more so a flexible portion between the mouth and also the nasopharynx. So we're talking about the upper, when we say the nasopharynx, we're talking about the upper throat area. So when we swallow, it helps move, it moves upward to prevent that food from entering the nasal cavity. Some other structures that are in this area as well is the uvula, and that's that small fleshy extension that hangs from the middle of the soft palate, and it basically helps guide or direct the food down the throat. So in terms of what other things it does, it helps with speech sounds, and it also is a portion of our gag reflex. All right, another thing that was mentioned that we saw on the picture was something called the fauces. And the fauces is basically the opening that connects the mouth to the oropharynx. So it's part of the throat right behind the oral cavity, and it allows the food and the air to enter or to pass from the mouth to the digestive and also the respiratory system. Now, the reason why these are important, they're important again for digestion and speech. The hard palate helps with chewing and also speech formation, and the soft palate prevents the food from entering the nasal cavity when we swallow. And of course, the uvula helps guide the food downward towards our throat, and it does help with speech as well. All right, now we're going to talk about the tongue, and we'll look at a visual on the next slide. It's a muscular organ, and it helps with speech, also taste. It helps with chewing, which we call mastication, and also swallowing, which we call deglutition. That's your mastication is chewing, and swallowing is deglutition. All right, so it is covered by mucous membrane. It's very movable, and it also allows for the food to move and keep help with speech as well. So in terms of the parts of the tongue, there's three main parts. We have the root, and that is the back portion that's attached to the floor of the mouth. We have the tip, which is the front end of it that's really flexible. And then we have the body, that's the middle portion between the root and the tip. So some of the key structures that are on the tongue are the lingual frenulum. And that is it's a tissue or a fold of tissue that anchors or keeps the tongue to the floor of the mouth. So it prevents from excessive movement. Some other things that are located on the tongue are bumps on the tongue. There are taste buds or taste and papillae. All right, so the tongue is covered with tiny bumps called papillae, and that give it texture. And that's also where our taste buds are located. So we have different types of papillae, and those are the fungiform papillae. They're found on the sides and also the tips of the tongues, and that's where the taste buds lie. And it allows us to sense the different flavors of our food. We have the folate papillae, and those are the posterior, they're located on the posterior lateral edges of the tongue. They also contain taste buds. And then we have the filiform papillae. They cover mostly the front 2/3 of the tongue. Now, they don't contain taste buds, but they do provide more so texture to help move the food while we're chewing it, and they look or appear white in color. In terms of the muscular functions of the tongue has two types of muscles that help with movement. We have intrinsic muscles that allow the tongue to change its shape. All right, and the reason why the changing of the shape of the tongue is important because it does help with speech, and it also helps with chewing or mastication. And then we have extrinsic muscles, which help us be able to move the tongue in the different directions. That's also important for chewing, and it's also important for swallowing. And swallowing is the term deglutition. So again, the importance of the tongue is for digestion and also speech. It helps us break our food down by pushing the food against our teeth. It helps move the food towards the throat in terms of when we swallow, and it also assists in speech production by controlling sound formation. And it also allows us, of course, the more enjoyable part of the experience, to taste our food. The other key takeaway from this is the lingual frenulum. All right, and it keeps it more so anchored to the mouth. And that is pretty much it for this slide. So we discussed the divisions of the tongue, so now let's look at figure 38.5 from your book, showing us the dorsal portion of the tongue, the top or the surface of the tongue. Again, we said it was divided into 3 sections. We have the tip, the root, and also the body of the tongue. All right, and on its surface, we said that it had a texture due to the papillae. So if you look at this picture here, you can see the little papillae that are on the tongue. Of course, it said we have different types of papillae, and they perform different jobs for us. So that forms that kind of rough texture of the tongue, and of course, they also contain our taste buds. So when we talk about the 3 regions or divisions of the tongue, again, we talk about the root or the back portion of the tongue that's closer to the throat. Of course, it's anchored to the floor of our mouth, and it contains our lingual tonsils as well, and those tonsils basically are going to help fight infection for us. All right, they are part of that lymphatic type system. All right, then we have the body, which is the main portion of the tongue. So the body, that surface is of course a little bit rougher, and it helps with chewing and also moving that food as we're trying to swallow it or digest it. All right, and then we have the apex or the tip of the tongue. That's the frontmost portion of the tongue, the more flexible portion of the tongue. And of course, the different movements of the tongue, in addition to the tongue being helpful for speech, the different movements help form speech or affect how we speak. And then also, of course, we have that sensation for feel, meaning the temperature of the food, and then also taste. So in terms of the texture, the different types of papillae, and of course their different functions, we have the filiform papillae. All right, filiform papillae here. And the filiform papillae, again, we said that they don't contain the taste buds, but they do help us with in terms of gripping the food and moving it while we're chewing it around. That's their main job. All right, then we have the fungiform papillae here. All right, here they're found more so on the sides and also the tip of the tongue. They do contain taste buds, allowing us to taste the different flavors of our food. And then last but not least, we have the foliate papillae here. They say that they're more of a leaf-shaped papillae, and again, they're on the sides and the back of our tongues, and they do also contain taste buds as well. So the different divisions of the tongue, again, help with the different functions when it comes to speech, digestion, and also swallowing. In terms of the papillae of the tongue, it helps with gripping our food, moving it around, and also detecting the taste and the temperature of the food. All right, this slide is, we're basically looking at a microscopic view of the taste buds, and this is figure 38.6 of your book, and it shows the circumvallate papillae on the tongue. So again, we're talking about the taste buds. So these are specialized sensory type structures that allow us to taste our food. All right, in terms of what these circumvallate papillae are, they're large, they're sort of dome shaped in appearance, and they're found on the back of our tongue. So they're typically arranged in a V shape near our throat area, and they do contain lots of taste buds for us that helps us detect flavors. So taste buds, in terms of their location, again, they're found on the sides of the circumvallate papillae, and they contain taste receptor cells, which they basically are sending signals to our brain when the food particles interact with them or come in contact with them. This particular slide of this taste buds is magnified 35 times, and we can see several taste buds opening into what they call the moat around the papillae, or the groove that is around the papillae. And the way that taste buds work is the food particles basically dissolve in our saliva, and they enter these grooves or these moats around the papillae, and they detect are able or capable of detecting 5 basic tastes, which are sweet, which detects sugars and carbohydrates; sour, they detect acids like citrus; salty detects sodium and also other minerals; bitter, in terms of the sense, we're talking about strong flavors and also toxins; and then umami type, and they detect things like meat flavors and also cheese flavors, and they send these signals to our brain so that we can interpret the flavor. So the importance of these papillae is they basically, again, they house or contain those taste buds, which make them helpful for detecting those flavors that we detect from our food. So again, these moat-like structures help trap those food particles, and it allows us to better detect or better taste our food. So they also do play another important role, and that's more of a protective role, by detecting bitter taste and also harmful substances before we swallow them. So the key takeaways when it comes to these circumvallate papillae is they're large papillae that are at the back of the tongue. Again, they're arranged in like a V type shape, and the taste buds are found on the sides of these types of papillae to help us detect the different types of flavors whenever the food interacts with them. All right, just expanding on the previous slide. On this one, still we're talking about figure 38.6, and this one is enlarged 40 times, so it's magnified 40 times. So again, we're still looking at the taste buds, and as you can see, it's kind of oval shaped, and of course it's embedded in the epithelium, so the surface layer of the papillae. For this one, we can see a pore, so at one of the taste pores, so that's like a small opening on the surface where that food that's been dissolved, those molecules of that food are interacting with, or a place where they can interact with those receptor cells. All right, so again, the way that our taste buds work is when we eat the food, that saliva and other chemicals will help dissolve the food, and of course those chemicals will enter the taste pores and activate what we call gustatory cells, and of course those cells are going to send the information that it perceives via the nerves to our brain, and we can identify the flavor at that point. All right, now we're looking at the floor of the mouth and the ventral surface of the tongue. So this is another figure that is in our book, of course, showing the floor of the mouth and the ventral or the underside surface of the tongue. And again, these structures help us with speech, swallowing, and also saliva production. So in terms of the floor of the mouth, we're talking about the portion that's located beneath the tongue. Is made up of soft tissues and also mucous membranes, and it's basically the pathway for structures like our salivary ducts, blood vessels, and also nerves. So some of the key structures that we can see here are the sublingual and the submandibular salivary gland duct openings. So these glands are responsible for secreting saliva, and they also help with digestion and lubrication when it comes to our food. Saliva, in terms of what it is, it contains enzymes, and those enzymes begin the process of breaking down the food before we swallow it. All right, we also see the oral mucosa, and that's a membrane as well, very thin, very delicate, and it lines the inside of our mouth. It protects the soft tissues and also provides moisture or lubrication to help keep our mouth functioning properly. Also, we see the gums right here, the gingiva, that supports our and surrounds the base of our teeth, and it also keeps our teeth stable and protected from bacteria. All right, so in terms of the ventral surface of the tongue, so now we're talking about the underside of the tongue. So unlike the top part of the tongue, it doesn't contain those papillae. So it doesn't contain the papillae, but it does have other structures that are important. So we have the lingual frenulum. All right, the lingual frenulum here, and that is basically a fold of tissue that anchors the tongue to the floor of the mouth, and it helps with speech production as well, and also swallowing. So in terms of that lingual frenulum, if it's too short, it can cause a condition called ankyloglossia, which is basically a person being tongue-tied, and it does affect speech. And if we're talking about like babies or infants, it can affect their feeding when we're talking about infants, like they're being able to suck their bottle properly. All right, then we also see the lingual veins here in blue, and they run along the underside of the tongue. So we can see them easily here because the mucous membrane is really thin, so we can see those veins. Another structure is the fimbriated folds. All right, so the fimbriated folds here, also called plica fimbriata. They're small folds of tissue that are under the tongue, but they're located very close to those veins on the underside of our tongue. And their job is, we don't really know what their job is, but they do help contribute to how flexible our tongue is. So again, some of the importance of these structures in terms of the salivary glands. Their job is to assist with food digestion and keep our mouth moist. That lingual frenulum and also the ventral tongue structures help with speech, swallowing, and also the ability of our tongue to move freely. And also the oral mucosa and the gingiva, it helps protect the mouth from bacteria and also injury. All right, so we talked about the lingual frenulum being too short in the last slide. So this is another slide that's in your book, figure 38.7. It shows us the floor of the mouth, mainly focusing on that lingual frenulum being too short. So this is a person that is tongue-tied, or they have that condition called ankyloglossia. All right, so this condition is when that lingual frenulum, again, that little fold of tissue under our tongue, is too short and also too tight. So when a person is tongue-tied, it does affect their speech. It also affects, their ability to eat, and sometimes it can affect their oral hygiene as well if it's severe. So with this one, the lingual frenulum is connected to the tongue, as you can see right here, and it restricts the movement because it's too short and it's also too tight. So in terms of things that it can affect, if we're talking about an infant, meaning a baby that is either breastfeeding or bottle feeding, they can have difficulty feeding because of this. Also, in terms of speech development, being tongue-tied can affect the way that we pronounce certain sounds or certain words. And then also, in terms of oral hygiene, they're going to have trouble cleaning as well, because of the fact that this frenulum is too short or attached. So that could lead to, if they have trouble cleaning, it can lead to cavities, which we can see right here in the back. All right, so some of the signs and symptoms of a person that is tongue-tied, of course, they're going to have difficulty sticking out their tongue past their lower teeth. You'll also be able to see a heart-shaped or notched appearance at the tip of their tongue when it's extended as well. And they typically are going to have trouble pronouncing sounds that begin with either a T, a D, an L, and an R. I'm having trouble. And they also have challenges with, let's say you wanted to play an instrument, a wind instrument, they would have trouble with that. They would have trouble with, not that we generally go around licking people, but they would have trouble licking, and they would also have trouble kissing as well. So those are some of the things that a person that is tongue-tied might have issues with. So treatment options for a person that is tongue-tied, if it's a mild case, of course they may be able to adapt over time, but if not, they would have a frenulotomy. Basically, it's a procedure where they clip the frenulum to allow the tongue to move more freely. And then you have frenuloplasty as well. That's a more advanced surgical procedure, where if the frenulum is very thick, it might require stitches. So those are three treatment options. One is adapt, and the other two, one is simple, and then one is a little bit more of an advanced procedure. So if a person is tongue-tied, it is important for them to be diagnosed early. Again, for a baby, eventually it might affect their speech. So if you've diagnosed it earlier, you can prevent those feeding issues, as well as issues that they might have with speech later on down the line. So this is the job more so of the pediatrician and also the dentist when it comes to a newborn. A person may also need speech therapy as well. Those are more so in those mild cases when surgery is not necessarily the option that the patient is going to go, especially in those mild cases. So again, it's important to catch it early. Again, it's because of that short, tight lingual frenulum restricting that tongue movement. And we want to catch it early so it doesn't affect the, especially if we're talking about an infant, their feeding. Also, when it's time for them to start speaking, their speech, and then also their oral hygiene as well. All right, so now we're taking a look at the intrinsic muscles of the tongue. So this is a slide in our book as well, figure 38-8, and it's showing us the muscles of the tongue, specifically the intrinsic muscles. And this is a coronal or more of a frontal cross-sectional view of the tongue. So again, the tongue is a muscular organ made up of intrinsic and also extrinsic muscles. And those muscles allow for movement of the tongue and also the flexibility of the tongue. So intrinsic muscles, they're responsible for things such as being able to change the shape of our tongue, and the extrinsic muscles are more so for control of the position of our tongue. So intrinsic muscles are located entirely within the tongue. So in the tongue, they're not attached to any bones, and they again allow for us to change the shape of our tongue. So if you've ever flattened out your tongue, curled your tongue, fold your tongue, these are your intrinsic muscles. They also help us be able to move the tongue in ways that help with speech, ways that help us eat, and also ways that help us swallow as well. So in terms of the types of intrinsic muscles, there's 4 pairs of intrinsic muscles. We have the superior longitudinal muscle, all right, and that one's located on top or in the superior area or surface of the tongue, and it helps us shorten, and also it helps us curl our tongue upward. All right, then we have the inferior longitudinal muscles as well. And those ones, they run along the bottom portion of the inferior surface of the tongue, and it helps us shorten, and it also helps us curl the tongue downward. So the superior helps us curl the tongue upward, and the inferior helps us curl our tongue downward. All right, then we have the transverse muscle here. They run from side to side across the tongue, and it helps us narrow and also elongate our tongue. And then we have the vertical muscle here, and that one runs up and down through the tongue. And in terms of the vertical muscle, it helps us flatten out the tongue, and it also helps us widen the tongue. So the reason why the intrinsic muscles are important is because it allows us to make, I'll say more so, fine adjustments in the tongue movement, which are important for speech. So being able to precisely control or pronounce words helps us with chewing or mastication. So basically helping us push the food upward towards the teeth. It helps us with swallowing, deglutition, meaning moving that food towards the throat. And it also, in terms of eating certain foods, it helps us roll, squeeze, and also shape the food in the mouth, such as, and there's that a thing that I can think of in terms of licking. When I said it earlier, if you are like licking ice cream or licking a piece of candy or even rolling a piece of candy around in your mouth, the intrinsic muscles help with that as well. All right, so now we're taking a look at the extrinsic muscles of the tongue. And again, this is a figure in the book as well, figure 38.8. More so just highlighting the extrinsic muscles of the tongue. So unlike those intrinsic muscles that help control the shape and the finer movements, the extrinsic muscles help more so with the positioning of our tongue. And these muscles are anchored to bones outside of the tongue. They help us move it in and out, of course, side to side, and also up and down. Whereas intrinsic muscles are inside of the tongue, so they don't attach to any bones that are outside of the tongue. So again, extrinsic muscles originate outside of the tongue, but they do insert into the tongue, and they allow for more movements that are larger, in addition to speaking, swallowing, and also chewing. So in terms of the types of extrinsic muscles, we have 4 main extrinsic muscles. This slide only shows 3 of them, but I do, in the when we're finished with the lecture, I do want to post a little game. I think it's a Quizlet game that shows you that 4th muscle. All right, so the first one is the glossus muscle. All right, and the glossus muscle helps with tongue movements in terms of forwards and downwards. So if you stick your tongue out or press your tongue against your lower teeth, that is the glossus muscle in action, and it originates from the mandible or the jawbone. All right, the next muscle is the hyoglossus muscle, which is right here, and that muscle helps move our tongue downward and also back. So in terms of actions, if you're flattening your tongue or you're retracting it back into your mouth after you've stuck it out, that is the hyoglossus muscle in action, and it originates from the hyoid bone, which is that U-shaped bone that's in our neck. All right, and for this slide, the last one that it shows us is the styloglossus muscle, and that one moves our tongue upward and back. So pulling your tongue back into your mouth, again, it helps with that. And also it helps us with swallowing. And this one originates from the styloid process, which is another bone or bony projection that is in the skull. So there is a fourth muscle called the palatoglossus muscle, and that one helps with more so elevations in the tongue. So it elevates the back of the tongue to help close off the throat when we swallow. And it also, so again, if you are raising your tongue to push the food up towards your throat, so it's a natural movement when we swallow. If you swallow right now, you can feel it elevating, and it originates from the soft palate. So the soft palate is not shown here, but it of course would originate in this area. And again, I do have a Quizlet game where you can see that one. So again, the reason why these muscles are important is it because it helps with speaking. So basically, our tongue positions itself differently when we're trying to pronounce different sounds. When we're swallowing, of course, it helps us move that food to the back of our mouth for us to safely swallow it. When we're chewing, of course, it helps keep the food in place while we're chewing. And then, of course, when we're breathing, the tongue basically positions itself to allow or to affect how that air is flowing. An important time to notice is when we're speaking. Of course, the tongue positions itself as well. So again, those extrinsic muscles control the position of the tongue, more so the larger movements, and the muscles that it relies on helps it more so change directions, meaning forward, backward, up, and down. And again, they also help with speech, eating, and also swallowing as well. All right, this slide focuses on our salivary glands. So the salivary glands are accessory glands that assist with or assist the digestive system, mostly in the fact that they help us produce saliva. And saliva does help with digesting food. It also helps us with things like maintaining good oral hygiene and and also lubricating our mouth. It keeps our mouth moist. So the glands are mostly located outside of the alimentary canal. However, they do release secretions in the mouth through ducts that we did see some of them a little bit earlier, or the beginnings of them. So we have three major pairs of salivary glands, and each of them, of course, they're located in different locations and they have different functions. So we have the parotid glands. All right, and the parotid glands are the largest of the salivary glands, and they're located in front of and also below the external ear, so near what we call a masseter muscle. All right, and their function for us in terms of what they do is they help produce saliva, and saliva contains enzymes like amylase, which we did work with in our lab, and they basically help start the digestion of carbohydrates or carbs. All right, the next one is our submandibular glands, and those are located just below. So sub means below, so they're below the mandible, submandibular, below the mandible, which is our jawbone, so that angle of the jawbone. And they help produce mucus, I'll say mucus secretions to help with digestion and also with mouth lubrication as well. And the last ones are our sublingual glands. So those are the smallest of the salivary glands, and they're located in front of the submandibular glands, but below or beneath the mucous membrane of when we're talking about the floor of the mouth. And their job is to produce mucus saliva as well, and that's going to help lubricate food, for swallowing purposes. So again, in terms of what saliva is, saliva, of course, it helps moisten the food to help with chewing and also swallowing. Nothing like having what we call dry mouth. So imagine putting something like a cracker in your mouth and not having any saliva to like moisten that cracker. All right, and it does contain enzymes like amylase that begin breaking down starches into sugar. Amylase also neutralizes acids, and that helps prevent tooth decay. And then also because, of course, we're working in the mouth with food, and it also keeps our mouth hydrated. And this is for basically the comfort of speech. If you've ever been talking a lot and your mouth gets kind of dry and you need to like drink some water or something to, I'll say, wet your whistle, as they say. Again, that's the job of saliva. Now, the reason why the salivary glands are important is because without saliva, the food would be not only difficult to chew, but also difficult to swallow. So I just gave you an example of, putting a cracker in your mouth and it not, being able to be moist. So the enzymes in the saliva are going to help start that digestive process before the food even reaches the stomach, even before we swallow it. So saliva also does contain, I'll say, more antimicrobial properties. So it again helps prevent infections, and it also helps us maintain our oral health. So it is, saliva is important. Again, the key takeaways here, we have 3 pairs of salivary glands: the parotid, submandibular, and also the sublingual, and they help produce that saliva, which aids in also the digestion and lubrication of the food, and it also protects our teeth as well. All right, so we just talked about the salivary glands. So now this is a visual of the location of the salivary glands, and this is figure 38.9 in your book. And again, it shows us the location of the salivary glands in terms of our head, and also, of course, we're looking at the neck area. So again, they help with digestion because they help produce saliva. And saliva is important because it's going to help us break down our food and also help keep our mouth moist. All right, we talked about the 3 main pairs of salivary glands, and we talked about their location in the different parts of the mouth. So again, the parotid glands right here, we did say it's the largest salivary gland, located and found in front of and below the ears near the cheek. So as you can see right here, the ears would be back here, and this is our cheek area. Of course, you can see that it is in our cheek area. All right, and again, this one produces saliva, of course, that contains those enzymes, especially amylase, that helps break down carbohydrates. Now, it does show some ducts here as well, specifically the parotid duct, or some books call it the Stenson's duct. And that one helps release, that duct helps release saliva near the upper molars. Now, our book doesn't really talk about it, but since it's in this visual, I just wanted to point that one out. All right, next we have the submandibular gland. All right, so here is our mandible right here, and as you can see, it is below. All right, so this is the sub means below, submandibular gland in terms of the location, just below the jaw or the mandible. All right, and it produces mucus and saliva, and it again helps with lubrication and digestion. In terms of the duct opening there, we have the Wharton's duct, or the submandibular duct right there, and that duct opens under the tongue near the lower front teeth. All right, so again, it produces the saliva right there, or releases that saliva right there. All right, and then we have the smallest salivary gland, which is here, the sublingual gland, and it's located beneath the tongue. As you can see, the tongue is here, so it would be beneath the tongue, but it's located in front of the submandibular gland. So the submandibular gland is here, and the sublingual gland is here. It's located in front, and it produces the saliva, which helps keep our mouth moist and also makes it easier for us to swallow. It doesn't show ducts here, but there are some multiple small ducts that are located in this area as well, called the rivinous ducts, and they again release saliva directly into what we call the floor of our mouth. Now again, the purpose of these salivary glands is to assist us with digestion by breaking down the food with the enzymes that they contain. Of course, they're going to moisten the food as we're chewing it, making it easier to swallow. And also, the saliva helps cleanse our mouth and helps with preventing infections. And it can also help enhance the taste of our food because, of course, when we talk about taste buds, we're dissolving those food particles. So we talked about the submandibular salivary glands. So now we're just taking a microscopic view of those glands in more detail. So this figure is in your book, is figure 38-9. Again, the submandibular gland has a mixed or compound type gland. So that means it produces both mucus and also it produces enzymes or enzymatic secretions as well. This particular microscopic view is magnified, I think it says 140 times, and it's enabled to be able to see the structure of those glands, including some of the cells and also the ducts. So again, we do have three major pairs of glands. And this one, the submandibular gland, is located below the jaw, below the mandible, so near the angle of our jawbone. And it does produce about 60 to 70% of the total saliva that we have in our mouth. In terms of the saliva that comes from the gland, it is released through a duct called the submandibular duct. And that duct is also called Wharton's duct, and it lies or opens underneath our tongue. All right, so in terms of the microscopic view, we can see the mucus cells here. And mucus cells, their job is to produce a thicker mucus or thicker saliva that helps lubricate the food and also the mouth. And they appear, in terms of their microscopic appearance, they're pale. Some people can even say they look kind of foamy when we look at them under the microscope. All right, we also have the serous cells as well, and they produce more of a watery type saliva and also enzymes as well, such as amylase, which we work with in our lab, and that helps break down the carbs or carbohydrates. And they appear darker and more granular in appearance when we look at them under the microscope. Then we also have ducts. All right, as you can see right here, here's a duct. So the job of the duct is to transport saliva from that gland into our mouth, so to push it to our mouth. And the ducts, in terms of their appearance, they're more round. As you can see, it's an open space in this view right here. So again, the job of the glands is to produce more watery or serous type saliva, and also mucus, which is a thicker saliva, to balance out the lubrication that we need for digestion. And they also help in terms of chewing, swallowing, and taste perception. And then they also contain, in terms of the saliva, also contain enzymes and also antibacterial properties to help us maintain our oral health as well. All right, so now we're moving on to part 2, which is structures and functions still of the upper digestive tract, but now we're going to focus on these objectives. So we're going to discuss the structural components of a typical tooth and identify by name and number the deciduous and permanent teeth. Define the term deglutition. Also identify the structural divisions of the pharynx and the structure of the esophagus. Discuss the size, position, divisions, curves, sphincters, layers, glands, and functions of the stomach, and discuss disorders of the upper digestive tract. All right, now we're going to discuss our teeth. So these are important for that mechanical aspect of our digestion. And regardless of the type of tooth that we're talking about, the structure of the tooth is going to be pretty much the same. All right, so in terms of the structure, it's going to have a crown, it's also going to have a neck, and it's also going to have a root as well. When we get into the teeth themselves, we have the first set of teeth, which are our baby teeth. More appropriately, we call them deciduous or primary teeth. And then as we grow, we have our permanent teeth. And there's also wisdom teeth as well. And then we have different types of teeth. All right, so this slide is basically just talking about the structure of a typical tooth. So a tooth is, I guess we can pretty much call it an organ for chewing, or mastication is the more official, appropriate term. All right, teeth are made up of 4 types of dental tissues, and the 3 main parts of the tooth are the crown, the neck, and also the root. Each part that we are going to talk about plays a role in either chewing, grinding, or some sort of structural supporting role in terms of the oral cavity itself. So in terms of the structure of the typical tooth, it's divided into these 3 main parts. We have the crown, which is the visible portion. That's the part that's exposed, the white part that's above the gum line, and it's covered by what we call enamel. All right, and enamel is the hardest substance of the tooth. Enamel is, in terms of its design, it can withstand abrasion, and it can also withstand the pressures that are caused by chewing. All right, the next part of the tooth is the neck. So that's like a transition area. It's more narrow in terms of its appearance, and that's where the tooth meets the root. So the neck of the tooth is surrounded by our gums, or our gingiva, which protects the tooth and helps anchor it in place in the gums. And last but not least, we have the root, and the root is embedded into our bones, basically the portion of the tooth that extends into the jawbone. All right, so it fits into the socket of what we call the alveolar process, which is part of the jawbone, and it's suspended by what we call a periodontal membrane. So it acts kind of like a cushion to hold that tooth in place. So again, in terms of the composition of the tooth, it is composed of some specialized tissues. Those are connective tissues, known as, or we call them dental tissues. All right, so we already talked about the enamel a little bit. That's the outermost tissue layer of the crown. It's also the hardest and also the most mineralized tissue in the body, and it does protect it against wear and also helps resist decay. All right, the next tissue type is the dentin, and that lies underneath the enamel, and it forms most of the structure of our tooth. It's less mineralized than the enamel, but it's still strong. I'll say it's still strong. It does contain what we call tiny tubules that connect to the nerves of our teeth. So it makes it more sensitive in terms of temperature and also more sensitive in terms of pressure. We also have in this area what we call cementin. So we talked about the dentin, now the cementin. And the cementin covers the root of the tooth and it helps anchor it into its socket. So it does provide more so of a surface area for what we call a periodontal ligament to attach to. The tooth also has a pulp, so that's the innermost portion of the tooth, and the pulp contains nerves and also blood vessels that help support the tooth. It supplies the tooth with the nutrients and also sensation as well. So again, more so for function and the importance of the teeth. We need them for chewing. We also need them for grinding our food for digestion. If you don't have teeth, or you know someone that doesn't have teeth, you also know that it does assist with speech and pronunciation of words. So when people don't have teeth, their word formation changes. If they have teeth one day and no teeth the next day, word pronunciation somewhat changes. And teeth also help support our jawbone and also our facial structure as well. So oral hygiene is going to be important in terms of protecting our teeth and also preventing decay. So now let's look at the main parts of the tooth that we just talked about. And this is figure 3810 of your book. This particular tooth, we're looking at a section of a molar tooth, more so to highlight or identify those internal structures that we talked about on the previous slide. So again, the tooth does consist of three main parts. As you can see right here, we have the crown, which is more so the right areas. So like if you were a queen and you put a crown on, that's what we're talking about. We have the neck right here, which is the junction below the crown and the root. The crown is, as you can see, above the gum line. And then, of course, we have the root down here that's embedded into the jawbone. This particular diagram also shows us the bony socket where the tooth fits into. It shows us the enamel structure, the dentin. It also shows us the pulp as well, and also some of the blood vessels that support the tooth. So in terms of the external layers of the tooth, we have the enamel, which is this area, this white area that covers the crown. The enamel is considered to be the hardest tissue that we have in our body, and it protects the tooth from decay. It also protects the tooth in terms of wear, because as we're chewing all of these years that we have our teeth, of course they could wear down, so the enamel helps protect from wear. The enamel itself is made of what we call interlocking rods. All right, and that is what you see right here. This cross section right here, it pulled it out. And those interlocking rods basically help strengthen the tooth. So this inset that we see right here basically shows the enamel rods, looking more so when we're talking about a microscopic view. They say it resembles somewhat a fish in terms of how it looks. All right, next we have the cementum. All right, and the cementum more so in terms of what it does, it covers the root of the tooth. So it's more so of a bone-like tissue that helps anchor that tooth into the jawbone. So it connects with what we call a periodontal ligament, and that periodontal ligament holds that tooth in place. All right, in terms of what we consider internal structures of the tooth, we have the dentin. As you can see right here, the dentin lies underneath the enamel and also the cementum as well. As you can see, this was the cementum down here. In terms of what the dentin does, it's softer than the enamel. It does make it more vulnerable to decay, and it does contain what we call tiny tubules that connect to the pulp. So it makes it more sensitive to pain in terms of feeling sensation. It's more sensitive to pain. All right, next we have the pulp cavity. All right, as you can see right here, the pulp cavity, that is the innermost part of the tooth, the portion that contains the nerves and also the blood vessels that provide nutrients and also sensation. If bacteria does reach this particular area, it can cause infection. It can also cause pain. So this is the portion that would be affected if we needed to have a root canal. So it's that infection and also that decay has reached this pulp area, and we would need to have a root canal if this area is affected. So in terms of tooth and bone connection, the root of the tooth, it does fit into a bony socket. All right, as you can see right here, this is a bony socket right here. And that bony socket, of course, lies within our jawbone. In terms of the what we call periodontal membrane ligament, of course, it acts more like a cushion to help stabilize that teeth. So the key takeaways from this visual, we looked at it. It allows us to look at the crown, the neck, and also the root. Of course, in terms of protection, we have the enamel of the tooth, and we also have the dentin and the pulp that provide structure and also sensation. The root helps anchor the tooth into the bone, and of course it's also held in place by that periodontal ligament. All right, so now we're going to look at the types of teeth, the different types of teeth that we develop as we grow. So as a human, we will have two sets of teeth. We have our baby teeth, which are called deciduous teeth, and we also have permanent teeth, which are our adult teeth. I'll also talk a little bit about wisdom teeth, third molars, and the difference between what we consider maxillary teeth and what we consider mandibular teeth. So our deciduous teeth, or our baby teeth, those are our primary teeth. Some people also call them milk teeth as well. We have 20 baby teeth in total, and these teeth, they start to appear around 6 months of age, and they continue to emerge until the child is about age 2 to 3 years. They do tend to start shedding between the ages of 6 and 13. So when they shed, they basically fall out, you know, the teeth that you put under the pillow for the tooth fairy. And they, of course, make way for the permanent teeth. So they need to make room, get out of the way for the permanent teeth. Our permanent teeth, which are our adult teeth, we tend to have 32 permanent teeth. So that's your full adult set, 32 in number. And these teeth, again, they're going to replace the baby teeth, and they include an additional set of molars. So again, your permanent teeth are designed to last you a lifetime with proper care. Now, it doesn't talk about the wisdom teeth, but we do have wisdom teeth. This is considered our third molars, and this is the last teeth, or the last, I'll say, pair, set of teeth to erupt. Typically, the wisdom teeth start appearing around age 17 or so. Some people may have all four. Some people may have fewer than that, and some people have none. Sometimes these teeth are impacted, so they get stuck under the gums. And if the person is having issues with these teeth, especially in terms of decay or in terms of pain, they sometimes need to be surgically removed. So when we talk about maxillary teeth versus mandibular teeth, Maxillary teeth are teeth that are in our upper jaw, so they're anchored to our upper jawbone or our maxilla. Mandibular teeth are teeth that are in the lower jawbone, and they're anchored to the mandible or the lower jawbone. So again, the key takeaways is as we develop over time, we're going to have two sets of teeth, which are the deciduous baby teeth and also the permanent adult teeth. You may also have wisdom teeth, but they do appear later on in life, and if you're having problems with them, they might require for you to get them extracted or removed by your dentist. Maxillary teeth, again, are going to be in your upper jaw, and mandibular teeth are going to be in your lower jaw. All right, now we're going to discuss the pharynx. We initially talked about the pharynx when we were learning the respiratory system, but the pharynx is considered to be a muscular tube that helps with not only the digestive system but also the respiratory system. So it's basically a pathway for not only food, because here we're talking about the digestive system, but also for air. All right, so it directs the food to the esophagus and it will direct the air to the trachea. Now, there is a process in terms of swallowing. The more official word for swallowing, or medical term, is deglutition. So when that food is moving from the mouth through the pharynx to the esophagus, that process of swallowing is called deglutition. All right, so now in terms of the structure and function of the pharynx, it is divided into different regions, and we talked about the regions again when we talked about the respiratory system. So it's divided into three regions, but only one is part of the digestive system. All right, so we have the nasal pharynx, which is the upper section located right behind our nasal cavity, only involved when we're breathing, so as air passes through to the trachea. We have the oropharynx, which is the middle section, is located behind the oral cavity of the mouth, so that's the passageway for food and also air. Food moves from the mouth to the oropharynx when we swallow. And then the lower section, or the final section, is the laryngopharynx, and that's located near our larynx, or our voice box is another term for that. And it does direct the food into the esophagus and air into the trachea. Also in that area, we have the epiglottis in this area, and the epiglottis, we learned in the respiratory system, is that flap of tissue that covers the trachea when we're swallowing. So when we swallow, it's going to prevent the food from, it's going to ensure that that area is closed off so that we don't I'll say aspirate food, and it prevents us from choking as well. So in terms of the role of the pharynx, so that was the structure. In terms of the role of the pharynx, in terms of digestion, once we chew our food and it mixes with saliva, it forms what we call a bolus, B-O-L-U-S. And a bolus is like, I'll describe it like a ball. It's a mass or ball of food. So after the tongue, basically, after the teeth, we've chewed it and it's mixed in with the saliva, the tongue basically is going to form and push this ball-like mass or food down the pharynx. So again, bolus is a ball or mass of food. So again, once the food is chewed and it's mixed with the saliva, it forms the bolus. And the bolus is pushed into the first portion, the oropharynx, by the tongue. Then the muscles of the pharynx will contract in order to move that bolus downward into the esophagus. And we'll talk about the esophagus next. And that's when that epiglottis kicks in. So the epiglottis is going to close over the trachea, all right, because the trachea, we only want air to go in there. It closes over the trachea to keep the food from entering our airway. So again, what happens after the pharynx is after the passing of the pharynx, that bolus is going to enter the esophagus, and the esophagus is the first part of the digestive tube proper. We call it the digestive tube proper, meaning it serves only for digestion at that point and not for respiration or breathing purposes. So again, the pharynx is more so of a shared passageway for both food and air. The oropharynx and the laryngopharynx are the portions that are involved in digestion, and the epiglottis, of course, is a special flap that covers the trachea to prevent us from aspirating food into our trachea while we're swallowing. So food is going to move from the pharynx into the esophagus, where it's going to continue down into our lower digestive system. So now we're going to introduce the esophagus for the next two slides. We're going to talk about it first, and then we're going to have a visual on the next slide. And again, we first introduced the esophagus when we learned about the respiratory system. It is a tube, it is muscular, and it connects the pharynx to the stomach. So it's the first segment of our digestive tube proper, meaning it's only responsible for digestion. So the esophagus, its job is to transport food. Specifically, we called it a bolus, from the mouth to the stomach through a process that we call peristalsis. All right, and peristalsis is like a wave-like muscle contraction to make the food travel downward. So there are three regions of the esophagus, or three sections, and those sections are based on the location. So the first section is the cervical part. All right, so cervical, we're talking about the neck if you learn the sections of your spine. So it's located in the neck, and it is located right behind the trachea. So this cervical part contains what we call the upper esophageal sphincter. All right, because it talks about muscular sphincters. All right, and that upper esophageal sphincter prevents air from entering the esophagus during the breathing process. So the next portion is the thoracic part. Again, if we're talking about the spine, the thoracic spine or T-spine is the next portion after the cervical part or the neck portion. So the thoracic part or the chest region part is located in the thorax or in the chest, right behind the heart and lungs. All right, and this portion, food moves through this region via that process of peristalsis that we talked about. Those wave-like motions are going to push that food down towards the stomach. All right, the last portion is the abdominal part, or the lower region is located in the abdomen near the stomach area, and it ends at what we call the lower esophageal sphincter. So that's a sphincter or a muscle that controls food being able to enter into the stomach. So sphincters basically are like, if you think about if you go to a club, like a bouncer at the door. So a sphincter allows for access. All right, it will open or allow you to enter, and it will block it so that you cannot enter. So that's the role of the sphincter. I'm sorry, that's the role of the sphincter. And again, the esophagus has two muscular sphincters, which it said right here. We have the upper esophageal sphincter, again located in the cervical part of the esophagus, to prevent that air from entering the digestive system while we're breathing. So it opens only when we're swallowing. And then we have the lower esophageal sphincter, which is not listed here, but we do have a lower esophageal sphincter as well. We call it the cardiac sphincter, and it's located at the junction of the esophagus and the stomach. So it prevents stomach acid from flowing back up into the esophagus. If it's malfunctioning, we have something called, if you've ever heard, acid reflux. That's what's malfunctioning there. So again, the sphincters help create more like a an opening or closing, or it only allows when it's ready to allow. It's just not freely open. That's what the sphincter muscles are for. All right, so again, in terms of function, when we're talking about the esophagus in digestion, the food moves through the esophagus through peristalsis. That's like rhythmic contractions or wave-like motions. The upper esophageal sphincter will open to allow food in, while the lower esophageal sphincter will open to allow food to enter into the stomach. So the lower esophageal sphincter is going to close tightly after that food passes to prevent that acid reflux, or that another term is it can cause heartburn if we do have that reflux coming back up into the esophagus. So the key takeaways here is that esophagus is a muscular tube that's divided into these three regions, which are the cervical, thoracic, and abdominal regions. And then we also have sphincters, upper esophageal sphincter, which prevents air entry, and the lower esophageal sphincter, which prevents acid reflux. And again, food is going to move through the esophagus by peristalsis. So not gravity, but peristalsis. Is basically forced to move via those wave-like contractions. Now we're looking at the visual of the esophagus, and this is figure 3812 of your book, and we're looking at the major features of the esophagus. So here we're looking at two views. Of course, we're looking at a picture of the human as the esophagus travels down, meaning location-wise of the body down to the stomach. And then, of course, here we're looking at the internal portion. So, again, we're just looking at the pathway from the throat down to the stomach. All right, and then this one, this posterior or this back view right here, we're looking more so at the muscular walls of the esophagus and also the surrounding structures like the lungs, and also we can see the C-spine back here. All right, and also the diaphragm as well. All right, so again, the esophagus, if we're looking at it, it is a muscular tube, and again, the job of the esophagus is to transport food from the mouth. We start at the mouth, and it goes from the pharynx all the way down to the stomach. So in terms of the structure and position of that esophagus, is located behind the trachea. All right, that is where it is located, behind the trachea. It's also located in front of the spine, so we can see the C-spine right here. Of course, we would have the T-spine and L-spine back here as well, but right now we're just looking at the T-spine, and then also the thoracic region. This is the chest area. In terms of the spine that's located back there, it would be the T-spine or the thoracic spine as well. All right, and of course we can see, we would see the abdomen in here as well. So again, it's going to pass through the opening in the diaphragm. There is an opening in the diaphragm right here, and right here we're seeing the opening in the diaphragm down here, and that's called the esophageal hiatus before it reaches the stomach. So in terms of the muscular layers of the esophagus, it does have what we call a muscular wall. The upper third consists of what we call skeletal muscle, and it's voluntary control. So it helps, we help initiate swallowing. We determine when we're going to swallow. It's not involuntary, but voluntary. The middle third of it is more so mixed. So we have both skeletal and also smooth muscle there. And then the lower third is smooth muscle, and smooth muscle is under involuntary control. So we don't control it. That involuntary control, meaning that peristalsis moves that food down to the stomach through those peristalsis wave-like muscle contractions. That's what forces or pushes that food downward. So in terms of the relationship, we have the esophagus. Of course, we can see the esophagus. It is positioned between the trachea, which is our windpipe, and the vertebral column. So those are, we're talking about our spine. All right, it runs behind the heart and passes through the diaphragm. So we can't see the heart on here, but we do know where the heart lies, which would be here. So it runs behind the heart, and it goes through the diaphragm, which we can see right here, before it connects to the stomach, which is right here. The position of it is important because any pressure from any of the other nearby organs, like pressure on the heart or pressure from a tumor, can cause or affect our ability to swallow. All right, so the positioning of it is very important. So in terms of, again, of the function, as we chew and then of course we swallow, the first thing that it will encounter is the upper esophageal sphincter. All right, the upper esophageal sphincter, which is here. All right, and again, that's an opening. It allows the food, it opens and allows the food to travel into the esophagus. All right, and as you can see right here, we're talking about the cervical part of the esophagus right here. This is the thoracic part of the esophagus right here. So the upper esophageal sphincter opens, allowing that food to enter. It will start traveling down that bolus of food through that peristalsis type movement, or wave-like movement, traveling down the esophagus, and then it will eventually enter or reach the lower esophageal sphincter. So that is going to open in order to allow that bolus of food to enter into our stomach. Once it enters, it will close. All right, we know that our stomach has enzymes and of course acids to help break down the food, and we don't want that to travel back up the esophagus, so that lower esophageal sphincter will open to let it enter, and it will close back after it has entered. So again, the key takeaways here, we're talking about the esophagus, this muscular tube that connects the throat to the stomach. Again, it does have three muscular sections that have what we call skeletal or voluntary motions in terms of swallowing. We voluntarily swallow. And then we have more so mixed and smooth or involuntary actions after that point. We do know that it is positioned between the trachea and also the spine, and its positioning or placement is important because there are other structures in that area that surround it, like the heart and also the diaphragm. So again, what allows the food to leave from our mouth and get into the stomach, the esophagus, is controlled by peristalsis. So it basically moves or forces that food downward, the lower, until it reaches the lower esophageal sphincter, which opens to allow the food into the stomach, and again it closes afterwards to prevent that acid reflux. This slide allows us to look at a microscopic cross-section of the esophageal wall, or the layers of the GI tract, and this is figure 3813 of your book. So our GI tract is composed of different layers. So there's four main layers that are visible here, and the layers are consistent throughout the digestive system. So from the esophagus all the way down to intestines, they will vary in function, and they'll also vary in terms of their thickness. So in terms of the layers, we'll first look at the mucosa. So the mucosa is the innermost layer. So this is the mucosa layer right here. All right, and the function for this layer is going to secrete mucus for lubrication, and it's also going to protect against friction from the food as it's moving. So in terms of structure, it's lined with what we call stratified squamous epithelium, as you can see right here. And that basically resists what we call mechanical stress from the swallowing. All right, the next layer is the submucosa, which is right here. All right, and this area contains blood vessels. It also contains nerves and also glands that help regulate digestion. So it is made up of connective tissue that support the mucosa. So it contains esophageal glands, and those glands secrete mucus to help aid that food in terms of passageway. So again, that is the submucosa, or the second layer. All right, the last layer, I won't say the last layer, but the next layer is the muscularis layer, the muscularis externa. This is the third layer. All right, and its function is basically to move food down the esophagus via that peristalsis motion, or that wave-like muscle contraction. So in terms of structure, the upper third, or the upper third is made up of skeletal muscle, so more so voluntary control. So again, when we swallow, that is voluntary. Then we have the middle third layer. It's mixed, so it has a mixture of skeletal muscle and also smooth muscle. So skeletal muscle is voluntary. We can control it whenever we want to, but smooth muscle is under involuntary control. So we don't control smooth muscle. It works all by itself. The last layer, or the outermost layer, is the adventitia, or the serosa is another term that it is called. And it basically anchors that esophagus in place and protects it from being damaged. So in terms of structure, and most of the esophagus is called the adventitia. And again, it's a connective tissue that holds it in its position or in place. In the abdominal portion, it's covered with what we call serosa. So serosa is more of a slippery membrane, so it helps kind of reduce some of the friction that's involved. So the reason why these layers are important in terms of digestion, the mucosa and the submucosa, they protect the esophagus from the food, especially more, I'll say, rough textures. The muscularis layer helps push the food downward to the stomach, and that adventitia layer keeps the esophagus stable within the chest cavity. So the key takeaways from looking at this view, again, we're looking at the esophageal, or the makeup of the esophageal wall, those four layers, which are the mucosa, submucosa, the muscularis, or the adventitia, or serosa for some texts. The mucosa helps us resist that friction, and the muscularis helps move that food down via that peristalsis-like motion. The esophagus itself has a mix of skeletal and smooth muscle. So again, as it transitions from voluntary type actions to involuntary type control, things that happen all by themselves if it's functioning properly. All right, now we're taking a look at the mucosal lining of the esophagus and also the stomach junction. And this is figure 3813 of your book. This is basically a cadaver dissection photograph. So again, we're looking at the mucosal lining, and this portion of it is the junction between the esophagus and also the stomach. So this is a region that it's a common site for irritation if we're talking about irritation due to that acid reflux from the stomach, meaning that lower esophageal sphincter doesn't open and close properly like it should. So we're having acid from the stomach reflux up into the esophagus. So this is the area that would be most affected. So again, this is that transition between the esophagus and that gastric mucosa. So again, you can see the shift in terms of the tissue structure, and then at this portion we would also see a shift in the tissue function as well. So in terms of the esophagogastric junction, which is the lower esophageal junction, that's the junction where the esophagus meets the stomach. So it's controlled by that lower esophageal sphincter that we talked about earlier. And again, it prevents that stomach acid from moving back into the esophagus. So it opens to allow the food into the stomach. And then, of course, it should close properly in order to prevent acid reflux. And acid reflux would cause what we sometimes call heartburn. So in terms of the difference in these mucosal linings, you can see that there is a noticeable change in this picture. So between the epithelial tissue between the esophagus and the epithelial layers or epithelial tissue in the stomach. So the esophageal mucosa above the junction, it's lined with what we call stratified squamous epithelium, which we talked about on the previous slide. So this area is basically designed to resist that mechanical stress from the chewing and also the swallowing. So this area doesn't produce mucus or protect against acid. The next little junction or area below that junction is called the stomach mucosa. All right, and the stomach mucosa is lined with simple columnar epithelium. So it does contain mucus secreting cells that protect against stomach acid. It also produces what we call gastric secretions that are needed for digestion. So that drastic or abrupt transition between these tissues, we call it the Z line. All right, now the reason why this area is vulnerable to acid reflux is because if that lower esophageal sphincter is weak, or it happens to, I'll say, malfunction, again, that stomach acid can enter the esophagus. And since the esophageal lining is not designed to handle that acid, it does become irritated, and that's what leads to that heartburn. We call it's acid reflux, but we call it heartburn. It can also lead to esophagitis, which is inflammation of the esophagus. And there's something else that we can see. Of course, I work in radiology, so one of our exams that we can or use in terms of our, I'm drawing a blank, our some of our fluoro procedures. One of the conditions that we can see in this area is something called Barrett's esophagus. So it's more so a precancerous condition that the radiologist can diagnose, and it's caused by chronic acid exposure. So from that acid reflux that, over time has caused a precancerous condition within the esophagus. So again, the key takeaways here, we want to note that esophagogastric junction that marks that transition between the different types of tissues, which are the squamous epithelium of the esophagus and that columnar epithelium of the stomach. Again, we want to mark the lower esophageal sphincter. Again, if it's functioning appropriately, it does prevent acid reflux, but if it fails and that acid refluxes back the stomach acids reflux back up into the esophagus, it can cause some irritation. And acid reflux can lead to esophagitis and also long-term complications like Barrett's esophagus. We talked about the oral cavity. We also talked about the esophagus. So of course, digestion begins in the mouth. After we swallow the food, it travels down the esophagus and it will eventually reach the stomach. So now we're going to talk about the size and the position of the stomach. So the stomach is considered to be a muscular organ, and it's located in the upper abdominal cavity. So it's located just beneath the diaphragm and also the liver. So in terms of size, the size and also the position can vary or change depending on different types of factors. And those factors include gender, body type, and also the food intake. So when we talk about body type, we're talking about whether the patient is sthenic, asthenic, hypersthenic, etc. So whether they're skinny or whether they're what we call average, or whether they're obese in size. So the position will change with those different body types, and also it will also change with food intake as well. The stomach is flexible, so it expands to accommodate food, and it also contracts when our stomach is empty. So in terms of the size of the stomach, in its empty state, the stomach is about the size of a large sausage, all right, as this slide tells us. In adults, it can hold approximately 1 to 1.5 liters of food and also liquid as well. So when it's stretched from overeating, it can expand significantly. All right, and if you've ever, I would say, eaten too much, of course, when you overeat, due to that expansion, it can cause some discomfort if it's stretched too much. So in terms of the position, the stomach, again, it does change with the body type, but it's positioned in the upper abdominal cavity, mainly to the left side of the body. It lies under the diaphragm and the liver, meaning its position again will change with breathing as well, since it's located underneath the diaphragm. So when we inhale, the diaphragm moves downward because it's accommodating the air entering the lungs. So the stomach is going to be slightly pushed downward, and then when we exhale, the diaphragm is going to move back up. Exhale meaning we've let that breath out, and it's going to allow the stomach to move back up. So that movement is normal, but if there is or was excessive movement of the stomach, of course, that could interfere with our breathing. Excessive movement and also excessive expansion of the stomach can interfere with our breathing. So in terms of when we talked about overeating and the stomach positioning, when the stomach is distended, meaning more so than it should be after we eat a large meal, since it's underneath the diaphragm, you should note that it will kind of depress or press against the diaphragm. So it can cause things such as dyspnea or difficulty breathing due to that pressure being placed on the diaphragm, making it harder for us to take a deep breath. So you might also feel pressure on your heart. So some people describe that sensation of, their heart being crowded. So we should not overeat in excess often. I know there may be times that we tend to overeat, like holidays, Thanksgiving, Christmas, but we shouldn't normally overeat. All right, so again, some of the key takeaways for you to note is that your stomach is elastic. It can change its size, and that's based on the food that we intake. It's located beneath the diaphragm, meaning its position will slightly shift with breathing, and you should note that overeating can cause some difficulty in terms of breathing and placing pressure on the diaphragm, and it can also cause some discomfort near the heart area as well. All right, so now we're going to talk about the divisions of the stomach. So it's divided into 4 major regions. And those regions, of course, they each have a specific function. I wish there was an image here, so I had to draw one just so that you'd be able to see it. But in terms of your book, this would be figure 38-14 that you would need to refer to look at these different regions. All right, again, these regions are going to help process that food as it moves from that esophagus to the small intestine. So eventually it will leave the stomach and lead to the small intestine. So the first region is the cardia. So that is the entry region. All right, and the cardia is kind of in this area right here. So it's a narrow collar-like area where the esophagus is going to meet the stomach. And that is the same area that contains that lower esophageal sphincter that prevents that acid reflux from the stomach back up into the esophagus. This is the esophagus area right here. All right, so again, food enters from the esophagus to the stomach in this cardia area. All right, the next area is the fundus, and the fundus is the upper portion of the stomach. It's more dome, I'll say they describe it as dome shaped, and it's right above the esophageal opening. All right, in terms of what we call the esophageal opening. All right, so the fundus, it acts kind of like a temporary storage area for food. Also, gases that are produced during the digestion, they kind of collect in this fundus area or this upper area, and they collect there before they're being released. All right, the next area or the main portion of the stomach is the body. That's the central portion. That's the largest portion of the stomach. So that's the main area where gastric juices are going to be secreted to help break down the food. Also, this is the portion that churns the food into what we call chyme. And chyme is like a mixture of half liquid, half solid. So it's like a semi-liquid in terms of what happens in terms of the body. All right, and then we're going to have the pylorus or the lower portion kind of towards the exit region. So this is the final section of the stomach before the food is going to start entering the small intestine. Now this area also has what we call a pyloric sphincter. Well, a pyloric canal and then a pyloric sphincter. All right, and again, a sphincter is something that allows things to enter. So the pyloric sphincter is going to control the release of that chyme, that semi-liquid, into what we call the duodenum, or the duodenum is what some people call it as well. And that's the first portion of the small intestine. So again, this is a kind of my mock-up of it, but some other areas that you need to be familiar with in terms of the stomach. And right now, this slide doesn't go over it, but I did want to show it to you on this particular slide. We have the greater curvature of the stomach, and then we also have the lesser curvature of the stomach as well, and we'll talk about that on the next slide. So in terms of the function of these divisions, the cardia region up here, that helps regulate the food entering the stomach, and it also prevents that acid reflux. The fundus, the largest area of the stomach, the upper portion of it, is going to store that food and of course release gases. The body is the primary site for that chemical digestion, and also the mixing of the food with the enzymes and acids within our stomach. And the pylorus area is basically going to control the food movement from the stomach into the small intestine. So again, the key takeaway in terms of the stomach, we have these four major areas: cardia, fundus, body, and also the pylorus. And each section has its own role to play in terms of the storage of the food, the digestion of the food, and also the movement of that food. And in terms of entry and exit, we do have the sphincter. So we have the LES up here. So basically allows for the food to leave the esophagus and enter the stomach. And then we have the pyloric sphincter down here, which is basically going to regulate that chyme flow. So meaning the chyme leaving the stomach and entering the small intestine. All right, now we're going to talk about the curves of the stomach and also the sphincter muscles of the stomach. So we did briefly point those out on the previous slide, but you're going to have to take a look at your book in order to see what we're talking about. So the two curvatures are the lesser curvature and the greater curvature. So you have to take into consideration that when we state where these are, you're looking at the patient. So it would be kind of the opposite of what you're thinking. So look at it in terms of, whenever we say the position of them, in terms of you looking at where it would be on your body. So the lesser curvature, when we looked at it on the picture, it was on our left side, but on the patient, because it would be flipped, the lesser curvature is the upper right surface. So it's the smaller inner curvature of the stomach, and it's located along the right side. So it connects basically the esophagus to the pylorus, and it also serves more of an attachment site for some other ligaments, some supporting or attachment ligaments. Now the greater curvature, which is that big hump, is the lower left surface. So it's a larger outer curve of the stomach located on the left side, and it basically extends from the fundus all the way down to the pylorus. So it provides like a space for the stomach to expand when the food enters, and it kind of stores it right there, and gas also is stored in that area. Now, in terms of our sphincter muscles, we have two that we've been talking about for a while. We have the sphincter muscle. Of course, their job is to control flow like a bouncer in and out. In terms of this, we're controlling that flow into the stomach and out of the stomach. So basically, the sphincter will contract and relax in order to open and close. So the lower esophageal sphincter, or the cardiac sphincter, is another term for it. It's located at the junction between the esophagus and also the stomach. So it opens to allow food to enter the stomach, and then it closes to prevent that acid that is in the stomach from refluxing back up into the esophagus. So again, opens to allow food into the stomach is the main job of it. The pyloric sphincter is located, so that's the bottom sphincter, is located at the junction between the stomach and the small intestine. So after the food has been processed and turned into chyme, it's now ready to enter the small intestine. So the pyloric sphincter will control that release of that chyme, which is partially digested food, into the duodenum or duodenum, however you would like to pronounce that word. So it basically slows the emptying of the stomach to allow for that food to be properly digested. So in terms of the function of these structures, the curvatures allow for the stomach to expand and also guide the movement of that food. The LES, which is the the lower esophageal sphincter, ensures that that food is going to enter the stomach, and it's going to prevent acid reflux. And the pyloric sphincter is going to control the speed of the digestion. So it's going to ensure that the food is properly processed before it can move forward. So again, the key takeaways from this is that within the stomach we have curvatures, and that's the lesser curvature, which is the smaller curvature, and the greater curvature, which is the larger curvature. The sphincter muscles are responsible for regulating that food movement and also preventing reflux. So the lower esophageal sphincter prevents acid reflux, and the pyloric sphincter controls the emptying of that chyme into the small intestine. All right, so now we're going to focus on the stomach wall and also some of your gastric glands. So the stomach wall, it does contain some gastric pits and also gastric glands. And those glands are basically responsible for producing the secretions that we need to digest food, so digestive secretions. And these secretions, again, they're going to help break down the food, and they're going to prepare it for digestion as it enters the small intestine. So if you look, so there is a figure in your book, figure 3815. It's going to show you a detailed example of what we talked about, the gastric mucosa, and I do think that we have a slide in which we'll look at this as well. So in terms of the structure of your stomach wall, the innermost layer of the stomach wall, we call it the gastric mucosa. And its layer is marked or has what we call gastric pits, and those are small openings that are going to lead to the gastric glands. Now, gastric glands are found below those pits, so they're primarily in the fundus and also the body of the stomach. The mucosa is also protected by a thick layer of mucus, and that mucus is going to prevent that stomach acid from damaging the tissues of the stomach. So in terms of the types of cells, we have three main types of cells in the gastric glands, and of course they all have a specific function. So we have chief cells, and the chief cells, they secrete what we call pepsinogen. So that's a enzyme that is converted into pepsin when it's exposed to the stomach acid. So it's inactive until it is exposed to our stomach acid, and pepsin's job is to help digest proteins into smaller peptides. And in our science interactive lab, I do believe that we work with amylase, hydrochloric acid, and also pepsin as well. So pepsin again helps digest proteins. We also have parietal cells, and those parietal cells secrete hydrochloric acid. Again, another thing that we work with in our science interactive lab, that 48-hour lab that you're supposed to do this week. So again, the parietal cells, they secrete this hydrochloric acid, and that hydrochloric acid is what activates that pepsinogen, all right, turns it into pepsin. So with the help of both of these, it's going to create that acidic environment that we need in order to kill bacteria. All right. Also, they secrete these parietal cells. They secrete what we call intrinsic factor. All right. An intrinsic factor is needed for vitamin B12 absorption in the small intestine. So again, we need this intrinsic factor before the food enters the small intestine so that it can continue to be processed properly. All right, the next type of cells that we have within the gastric mucosa or the stomach wall are endocrine cells. And the endocrine cells secrete gastrin. All right, and gastrin is a hormone that stimulates acid production and also stomach motility as well. All right, so again, all of these are gonna, well, this is basically this gastrin is gonna help regulate digestion. All right, so again, in terms of the importance of these gastric glands that we talked about, the pepsin that comes from the chief cells are going to digest proteins. The hydrochloric acid, which comes from the parietal cells, are going to help create that acidic environment that we need for digestion. And then the gastrin that comes from the endocrine cells is going to help regulate the overall function of our stomach. So again, these are all needed in order to properly process and digest the food. Last but not least, we're not going to leave that mucus layer out. We do have a mucus layer as well, and that mucus layer is needed in order to protect our stomach lining from acid damage, since we do have this acid in our stomach to help process the food. So again, the key takeaways here, gastric pits, they will lead to these gastric glands, which secrete the digestive enzymes and acids that we need to properly process the food. The chief cells release that pepsinogen, which becomes pepsin to digest those proteins. The parietal cells produce hydrochloric acid and also that intrinsic factor that we need to further digest the food once it enters our small intestines. And then, of course, the endocrine cells are going to secrete that gastrin that will stimulate the digestion within our stomach. All right, this is figure 3816 of your book. So we just focus on the gastric mucosa. So here we're just taking a look at a micrograph that's been magnified 4 times in order to see the composition of the gastric mucosa microscopically. So this image in particular highlights the gastric pits, also those underlying gastric glands, which we do need for that digestive secretion. Also, we can see some of the rugae, so basically the folds of the stomach lining that allow it to, of course, expand and contract when it's full or when it's empty. All right, so in terms of the structure, we have for the gastric mucosa, which is the inner lining of the stomach, again, we can see some of the gastric pits, all right, within the, and also the gastric glands. So the gastric pits, again, those are those small openings that lead to the gastric glands. And the gastric glands, we know that they are responsible for producing those digestive acids and also those digestive enzymes that we need. Now, the mucosa itself is covered by a thick layer of mucus, and again, that mucus is needed to protect our stomach from the stomach acid. So in terms of the role of the gastric pits, we learned earlier they're located in that epithelial lining of the stomach, and they act as that entry point for those secretions of those gastric that are produced from those gastric glands. And the gastric glands, which are located below the gastric pits, they extend into the mucosa. However, they contain those chief cells, the parietal cells, and also those endocrine cells that we just talked about that are responsible for producing those digestive juices. In terms of the rugae, of course, you know that those folds in the stomach lining allow for it to expand when the food enters and also for it to contract when our stomach is empty. So they do primarily, they're more prominent and when they're folded. So again, as the stomach fills with food, the rugae flatten out to accommodate for that volume, and when it's empty, of course, they fold back up because the stomach is empty. It doesn't need to be expanded. So the reason again why the glands and the pits and the are important for digestion. So why the glands and the pits are important for digestion is because of the fact that they produce that pepsinogen, which you're working with in your lab, the hydrochloric acid, and also the mucus. All of that is going to aid in digestion. Also, the rugae are important because it increases the surface area for our stomach, allowing it to expand and contract once that food is digested. All right, now we're looking at an isolated epithelium, specifically the gastric epithelium, and also the parietal cells. And this is 3816 in your book as well. It's an electron micrograph that's been magnified 500 times so that we can take a look at the gastric mucosa epithelium. So basically, it's highlighting those gastric pits that lead to the gastric glands, and also some of the parietal cells are visible. The little dome-shaped bulges that are on the tissue are the parietal cells. So again, that gastric epithelium, that's the innermost layer of our stomach. So it forms that protective barrier of the stomach. It consists of specialized cells, and those cells again help secrete mucus, acid, and also those digestive enzymes that we need. So the epithelium itself does regenerate itself rapidly, and it's needed in order to protect your stomach against the acids that it has to encounter daily as we're trying to digest our food. All right, in terms of those gastric pits and also the glands, and we've already stated this multiple times, but the pits, the little small depressions in the epithelium, they lead to the gastric glands, and the gastric glands are located at the base of the gastric pit. So again, these glands help excrete or secrete those digestive fluids that we need to properly process the foods that we eat. In terms of the parietal cells, again, here they appear like those little dome-shaped bulges in the epithelium. In terms of their function, they secrete that hydrochloric acid, which activates that pepsinogen, turns it into pepsin for protein digestion. So it also helps maintain a lower pH to help kill that harmful bacteria that might try and live in our stomach. So again, another thing that it does is it secretes what we call intrinsic factor, and we need that intrinsic factor in order to be able to absorb vitamin B12 once the food does enter our small intestine. So again, the importance of the structure when it comes to digestion in terms of the gastric epithelium is going to protect the stomach from the damage from the acid. The pits and the glands are responsible for secreting those digestive enzymes, acids, and also the mucus that we need. And the parietal cells themselves are going to regulate your stomach acidity and also the vitamin absorption. So we talked about the gastric mucosa, which is that innermost layer or lining of the stomach. So now let's talk about the gastric muscularis and also stomach contractions. So the gastric muscularis is a thicker layer of smooth muscle that's in our stomach wall, and it does consist of 3 distinct layers that are arranged in a crisscross pattern, and the structure basically allows for mixing and also mechanical digestion. So the 3 layers of the gastric muscularis, unlike the other digestive organs that only have 2 layers, the stomach itself has 3 layers. So we have an outer longitudinal layer. So basically the fibers run lengthwise along the stomach, and it helps in shortening the stomach during contractions. Then we have a middle circular layer, and these fibers tend to wrap around the stomach, and they're responsible for narrowing the stomach in terms of diameter during the contractions. And then we have an inner oblique layer as well, and it runs basically diagonally, and it's responsible for enhancing the churning and also mixing actions that happen within the stomach. So the importance of these crisscross patterns is because these three layers work together in order to properly mix the food with the digestive juices that are in the stomach. Also, the wave-like motion that we call peristalsis, or those contractions that help push the food forward, it assists in ensuring that that happens properly. Specifically, the oblique layer, it adds more of an extra churning effect when the food is being broken down into those smaller particles. So it's going to allow for the production or creation of what we call the chyme, meaning we're turning that solid food into a semi-liquid type substance that's going to eventually move into the small intestines, where it can be further digested. So again, the crisscross muscle patterns make the stomach more effective in terms of that mechanical digestion, meaning the solid food being able to be turned into that chyme. It ensures that the enzymes and the acids also are going to be able to fully coat the food particles so that they can be broken down. And also, in terms of churning, it prevents larger food particles from entering the small intestines, because larger food particles, if they're not in that semi-fluid type state, they could disrupt that digestion process. So again, the gastric muscularis is composed of 3 layers, and of course those muscle layers are in longitudinal form, circular form, and also they lay in an oblique pattern. So again, they make this crisscross pattern that allows for more powerful contractions and also better mixing of the food within the stomach. And all of these motions are going to enhance that digestion process and prepare that food for absorption as it enters into our small intestine. We talked about the stomach. We've talked about the structure of the stomach. We briefly talked about some of the functions of the stomach, but now we're just going to go a little bit more in depth into the functions of our stomach. So basically, we do know that it does play a role in digestion in terms of storing, in terms of mixing, and also in terms of breaking down foods. We know that it excretes enzymes and acids as well as other hormones that are going to aid in digestion and also protect the body as well, in terms of protect it from the acid. And also we talked about it being a reservoir, so it's temporarily holding the food before it moves into the intestines for further breakdown or digestion. So some of the major functions that it talks about here is that it secretes gastric juice. So it contains what we call hydrochloric acid, which we talked about earlier, and also digestive enzymes like pepsin to help break down proteins. In terms of mechanical digestion, bullet number 2, it is going to help break down the food into smaller particles and mix with that digestive or gastric juice. So those muscular layers that we just talked about, they're going to contract to mix the food with the gastric juices that are within the stomach, and it's going to turn it into something called chyme, which is a semi-liquid substance that will eventually be released into the small intestines. Another thing that it does is it secretes intrinsic factor. So intrinsic factor is needed in order for us to be able to absorb vitamin B12, which we do need for red blood cell production. And then it performs limited absorption. So what that means is the stomach only absorbs small amounts of things like alcohol, water, and certain medications, but um, it does absorb some. Most of the absorption happens in the small intestine. So once that chyme is released to the small intestine, that's where the majority of the absorption will happen. All right, in terms of hormone production, it does produce gastrin, which stimulates acid secretion, and also ghrelin, which is more so a hunger hormone. So it basically tells our body when we need food. And then last but not least, it does protect against pathogens. So the fact that it's an acidic environment, it does kill harmful bacteria that's ingested with the food. If we did ingest some type of harmful bacteria or pathogen when we ingest our food. So again, the stomach is more so a food reservoir. It stores what we consider partially digested food, which is chyme. It does control the release of that food before it enters the small intestine, so it does regulate the pace of that. Um, and the pace is, we do need to regulate the pace because we don't want to overload the intestine. We do want to allow for efficient digestion, meaning if that chyme pass too slowly or too fast, the food would not be able to digest appropriately. So again, we need for that chyme to move slowly through the stomach so that the nutrients and the nutrient digestion and also the absorption can be maximized once it does enter our small intestine. All right, so again, the key takeaways in terms of our stomach's function is more so stores the food, mixes the food, and starts that digestive process in terms of the food. It secretes acids, enzymes, and also hormones that we need for digestion, and also it does play a role in immune defense by ways of destroying and killing any harmful bacteria that we may have ingested while we were eating. All right, now we're going to talk a little bit about disorders of the mouth and esophagus. So the first one is Sjogren's syndrome. And Sjogren's syndrome is an autoimmune disease, and that's where our immune system attacks our glands, specifically your salivary glands and also your tear glands. And what it leads to is dry mouth and dry eyes as well in terms of the tear glands. And in terms of our mouth, it does increase the risk of cavities and also infections because we don't have that um, saliva production that we need. All right, the next one is mumps. And mumps, another word for mumps is periotitis, and that is a viral infection that causes swelling and also inflammation in the parotid glands, which are one of the major salivary glands. Again, this one does affect the mouth. And this one spreads through your saliva, mumps. It can spread through your saliva. It can also spread through respiratory droplets. So like if we were to sneeze. For this one, for mumps, typically we do get vaccinated when we're younger. So MMR, mumps, measles, and rubella. And that one, that vaccination can prevent mumps. But of course, some people, they do not get vaccinated. The next one, in terms of what could lead to tooth decay, the first one is gingivitis. And itis, we're talking about inflammation. So gingivitis is inflammation of our gums. Typically is due to, I'll say, poor oral health, and it's caused by plaque buildup. Once we get that plaque buildup, if it continues, we don't take care of our teeth, it does lead to red, swollen gums, and typically, whenever we brush our teeth, our gums will bleed very easily. This one is reversible with proper flossing, proper brushing, and also dental care as well. The other one is periodontitis. No, periodontitis. Yes. All right, and periodontitis is also it's I'll say similar to gingivitis. This one is more severe though, so it's a gum infection, more so affecting that periodontal ligament. So that's the tissue that anchors our teeth to the jawbone. So periodontitis can lead to tooth loss if it continues. So if we don't get it treated, we can lose our teeth. The next one is leukoplakia. So that one is a precancerous condition where we get these thick white patches. They form on those mucous membranes. This one is often caused or linked to people that use tobacco. And the last one here is malocclusion. So malocclusion is misalignment of our teeth, which can cause us to have difficulty chewing. Malocclusion, we can also have difficulty with our speech, and we can also have jaw pain due to that misalignment of the teeth. So misalignment of the teeth can be due to us missing teeth. It can be due to overcrowding, meaning your teeth are very crowded. There's not enough space in between them, or just improper tooth alignment. So with all of this, it's important for us to get them detected early, and also some of this is going to prevent some of these conditions from happening. So some of the things that we can do for prevention's sake is practice good oral hygiene that can prevent some of these disorders like our tooth decay. Vaccinations can prevent things such as the viral infection caused the mumps, which is caused by a viral infection. And then also routine dental checkups. We can detect and also treat some of these conditions earlier. So now disorders like the Sjögren's syndrome, we're not necessarily going to be able to prevent that one, but we do know that that syndrome and also the mumps and also the gingivitis is going to affect our oral health, which can lead to affecting our digestive health. Now, the periodontitis and also the leukoplakia, again, those can lead to more severe complications if we leave those untreated. But again, with proper oral care, also regular checkups with the dentist, of course, if we can afford it, some people can't afford it, that can help prevent some of these conditions. All right, so we talked about some of the disorders that can affect more so our mouth area. So now let's talk a little bit about some of the conditions that can affect our esophagus. So again, the esophagus and the stomach, they can all be affected by disorders as well. And those disorders, when we're talking about the esophagus and the stomach, those are the disorders that are going to cause discomfort. Not that tooth decay wouldn't, but these would cause discomfort, and they would also impact our digestion as well. So these disorders can range from as mild as something like heartburn to something more severe that would require us to have some type of medical intervention. So again, just like with the disorders that affected the mouth, the key is to get an early diagnosis, to get treatment if you are diagnosed, and then also prevention is good as well. So some of the common disorders of the esophagus and also the stomach, one is gastroesophageal reflux disease. They call it GERD. So it occurs basically when the stomach acid is allowed to flow back up into the esophagus, and it causes heartburn. So basically a burning sensation in our chest. So it can lead to esophageal damage if we do leave it untreated. So again, when we talked about the sphincter opening and closing properly, for this one, that lower esophageal sphincter doesn't close properly. And of course, we have that acid being refluxed back up into our esophagus. All right, the next one is gastroenteritis. All right, so itis is there, so we know we're talking about some type of inflammation. This one is inflammation of the stomach and also the intestines. Gastroenteritis is commonly due to some type of bacterial, or it can be caused by a viral infection. And some of the symptoms that the person might have if they have gastroenteritis is nausea, vomiting. They might have diarrhea. They also might have stomach cramps. And gastroenteritis is sometimes called the stomach flu. All right, another disorder in this area would be anorexia. So anorexia is basically a chronic loss of appetite. It's often associated with some type of underlying medical or psychological condition. And anorexia can lead to severe weight loss. It can also lead to malnutrition as well because the person isn't eating like they should. The next one is nausea and emesis. All right, so we're basically talking about vomiting. In terms of nausea, the person might feel queasy, feeling like they need to vomit. And then emesis actually is the actual process of vomiting if we did actually vomit. So it occurs when the body is expelling the stomach content. So some causes of the nausea and also the emesis could be motion, so meaning the person might have motion sickness. We might have that if we are pregnant. Of course, we're talking about women at this point. Some infections can also cause nausea and emesis, or nausea and vomiting, and then also food poisoning could cause this as well. All right, the last two um, conditions or disorders are pylorospasm and pyloric stenosis. So pylorospasm occurs when that pyloric sphincter fails, so it fails to relax. And when it fails to relax, it prevents the food from passing into the small intestine where it needs to be further digested. And pyloric stenosis is a condition mostly in infants where where the pylorus becomes narrowed, and that leads to vomiting, severe vomiting, and also it can cause dehydration. So in terms of intervention for pyloric stenosis, the infant may need surgical intervention, and that's usually required to widen that narrowed area. So again, in terms of these disorders or conditions, in terms of GERD, we just need to manage it. Sometimes that may require some type of lifestyle change to prevent that complication. Um, Proper hygiene in terms of the oral or mouth disorders, and also proper hydration. So hygiene and hydration can prevent the gastroenteritis. And then, of course, recognizing that you have symptoms early can prevent severe outcomes, such as if you don't notice the pyloric stenosis, what would be the result of continued pyloric stenosis, meaning that the food is not able to leave the baby's stomach. So, of course, they're going to be vomiting the food instead of digesting the food and absorbing the nutrients from the food. So, again, these are some of the disorders that affect the mouth and also the esophagus. All right, and this concludes our lecture on the digestive tract, specifically the upper digestive tract. And if you have any questions, please feel free to email me or send me a text so that we can get those questions answered. I hope that this is helpful for your studies this week.